Anxiety and PTSD impact more than just the mind. They shape how we breathe, how we sleep, how we connect, and how we feel in our own bodies. And while talk therapy can be effective, it doesn't work for everyone. Sometimes words aren't accessible. Sometimes the nervous system is too overwhelmed. That's where music therapy can offer a different kind of healing. Trauma doesn't just live in memory. It lives in the nervous system, shaping how we react to stress, how we process emotion, and how we relate to others. People with PTSD may experience hypervigilance, emotional numbing, flashbacks, panic, or dissociation. Music provides another way in, a nonverbal, somatic, and deeply human way of reconnecting. It's a structured, clinical healthcare practice delivered by a trained and licensed music therapist. A 2024 meta-analysis in Frontiers in Psychology examined over 500 individuals with PTSD and found that music therapy significantly reduced trauma symptoms. The effect size was strong, nearly equivalent to traditional psychotherapy. Music activates multiple areas of the brain simultaneously, including the amygdala, hippocampus, motor cortex, and prefrontal cortex. This matters because trauma can disrupt these same regions, making it harder to regulate emotion, feel safe, or speak about one's experience. Rhythmic entrainment, matching movement or breath to a steady beat, has been shown to reduce heart rate and cortisol levels. A review in Health Psychology Review confirmed that rhythm-based interventions support parasympathetic regulation. A veteran with PTSD uses structured drumming to regulate fight-or-flight responses and regain bodily awareness. A refugee reconnects with cultural identity through familiar songs, a process shown to reduce post-migration stress. A teen with panic disorder writes and records songs using lyrics to express what would otherwise stay locked inside. A domestic violence survivor uses breath, toning, and improvised music to rebuild a sense of control over their body. Music therapy aligns deeply with trauma-informed principles: safety, choice, trust, collaboration, empowerment. It offers an alternative when words fail, when silence feels safer than speaking, or when the body needs to lead before the mind can follow. Music therapy won't erase trauma, but it helps people carry it differently, with less fear, more self-awareness, and a greater sense of safety. Because music does more than soothe. It activates the brain, supports expression, and rebuilds connection. When words aren't possible, when the body needs regulation, music therapy offers a bridge between survival and healing, between silence and speech, between trauma and recovery.